positivity rate over 8%, except for those in the 80-plus age category. And when it came to the total raw number of cases, children under the age of 18 made up 27% of all cases last week, similar to the previous week. And the positivity rate in children was actually the highest of all the age groups. It was 13.5 in the 10 to 19 age category, and 10.8 in 0 to 9, which happened to match the 40 to 49-year-old age category. The actual age category that had the most raw cases was the 30 to 39-year-old age category, which we've seen for quite some time. But children made up a substantial amount of the cases and had the highest positivity rates. As we noted, it was 9.9% for the week last week. It was a little higher than the week before, which was 9.4%. This is the highest percentage since May of 2020, when testing capability was very limited. And while the overall raw cases by week to week declined by about 2% from the prior week, the week ending November 20th, it was mainly due to there being lack of testing during the holiday and the weekend following the holiday. If we had received the traditional number of tests that we would get on a week basis, we would have in all likelihood far surpassed the case total for last week than we did the week before. Now, cases per zip code for week ending 11/27, this may be a little difficult for some who are watching on television, a little easier for those who are watching on the internet, but there was some very high, extremely high case rates in zip codes per 100,000 residents over a 7-day period. The Boston zip code 14025, basically 1 out of every 100 residents in that zip code had a new COVID-19 case last week alone. Lancaster has been very high. Springville, Eden, Alden, Derby. North Collins, which was the highest rated last week, actually has dropped, but it's still in the top 10, unfortunately. These are mostly suburban and rural areas that have the highest case rates per zip code. There are some Buffalo areas, of course, that are high too, but in general, the suburbs and the rural areas have much higher rates of transmission based on the 100,000 residents over a 7-day period. As I said last week, and we're still very worried if these rates continue or worsen, we may not be able to control the further spread of COVID-19 in our community. That's why we have a mask mandate in place for all public locations. Weekly student and school staff COVID-19 cases, actually a slight reduction in overall cases among staff and students, though there was an increase among staff, and it just shows, once again, it's reflective of the community's prevalence and the transmission of COVID-19 in our community in general. Hospitalization data for the 2-week period ending November 27th. Hospital patients have increased, COVID patients that is, by 65% in the past 2 weeks. 18% of Erie County COVID-19 hospitalizations are in the ICU, and the hospitals are at or near capacity for inpatients. 89.3% of all staffed beds in Erie County hospitals are full, and 86.7% of ICU beds. And as I'm going to go into in greater detail now, as we look at hospitalization rates, we are much worse with regards to overall COVID-19 hospitalizations for all of Western New York, though we're not really that different in Erie County year to year. But we see a tremendous problem, of course, with full hospitals due to everything else, not just COVID-19 patients, but all patients. So here's the chart. There is a break there for what would be considered November 25th, Thanksgiving. For whatever reason, the state didn't release any data out, so we don't have any data for actual Thanksgiving, but we have it for the other days, so there's a little break there. But you do see the increase for up to November 27th, in which we have a little less than 350 patients in total in Erie County hospitals. Now, I wanted to do a year-to-year comparison so people understand what we're looking at. On November 28th, 2020, there were 386 COVID-19 patients in all Western New York hospitals. 327 of them were in Erie County hospitals and 59 in the other counties' hospitals. The other counties being Niagara, Chautauqua, Cattaraugus, and Allegheny. Genesee, Wyoming, and Orleans are not considered part of the Western New York region by New York State for COVID-19 purposes. And they also don't even have any hospitals, so it really doesn't matter in some ways. So that was last year, 386 total patients, 327 in Erie County, 59 in the other counties. On November 28, 2021, there were 484 COVID-19 patients in all Western New York hospitals, 334 of them in Erie County, and 150 in the other county hospitals. Remember, last year, on November 28th, there were only 59 in the other county hospitals. This year, there were 150. We've seen a slight increase in Erie County hospitalizations. Not a huge increase year to year, but a big increase for the other counties. And I know the other counties' hospitals are at or near capacity as well. So we're seeing a lot of COVID-19 in these other counties, and their patients are not only in their own hospitals, some of them are coming to Erie County. To give you an idea of the difference between year to year, let's look at a couple hospitals. On November 28, 2020, ECMC had 442 patients, 36 in the ICU. Not all of them were COVID-19 patients, but they had 442 patients in total, 36 in the ICU. On November 20th, 2021, ECMC had 552 patients, 47 in the ICU. The 552 patients was capacity. It was 100%. Every bed in ECMC was full as of November 28th. I talked to Tom Croce, the president and CEO of ECMC, a lot over the last few days. They did have a few more discharges in the last 24 hours, so that's helped, but they are basically at 100%. Now let's talk about St. Joe's. On November 28th, St. Joe's, November 28th, 2020, St. Joseph's in Cheektowaga, run by Catholic Health, was a COVID-19 only acute care facility, and 112 patients, pretty much all of them were COVID. On November 28, 2021, St. Joe's is no longer an acute care facility, no longer a hospital, and they have 0 acute care patient beds. So last year, Catholic Health wisely created basically a COVID-19 only facility at St. Joe's. And unfortunately, they were full with COVID patients. This year, they decided to take it from a non-acute care facility to a subacute care facility in their process of making that change. So there are no patient beds, no patients at all, because there are no patients available at St. Joe's. So we lost 112 beds, which were strictly for COVID patients last year, which now has to be spread out among the rest of the hospitals. What does this mean? Hospitals across Western New York are at or near their staffed bed capacity. I'm going to turn it over to Dr. Burstein now to talk a little bit about what the most recent analysis from the Western New York and analytical group, COVID-19 analytical group, based out of UB Medical School, is finding, and why we must wear masks.
Thank you. Good afternoon. So as the county executive mentioned, this is a model that Dr. Peter Winkelstein from the Jacobs School of Medicine Bioinformatics Department has put together to try to predict what our COVID-19 hospital census will be in the looking at where it is now and where it will be in the future. So just to orient everybody to what this graph means, so the blue dots mean that corresponds to the COVID-19 hospital admissions, hospital census at any given date. The yellow line corresponds to what Dr. Winkelstein's model predicts the COVID-19 hospital census will be based on our COVID-19 prevalence, people's behaviors with masking, social distancing, vaccinating. The x-axis corresponds to the date, starting from October 2020, going all the way through the end of this year in 2021. And the y-axis is looking at the COVID-19 hospital census. And so you can see, remember at the end of last year, at the end of October of 2020, the weather got cold. There were many Halloween parties, and everybody came indoors, and we saw a shoot up of hospital admissions, and we saw a significant increase in the Erie County Hospital COVID-19 census, where actually you could see that the census was higher than even Dr. Winkelstein's model predicted. So fast forward to this year in October 2021, you can see again, looking at the red arrow, that at the end of October, again, we saw a weather change, and we're seeing an increase in the total COVID-19 hospital census, where it is significantly increasing as a result of the cold weather, people not masking. We have lower numbers of vaccinations that we'd like to have, little social distancing, and our numbers continue to climb. Where actually you can see with the blue dots that again, the hospital census is even higher than what Dr. Winkelstein's model predicts. So the second red arrow corresponds to the county executives and my mask mandate. So as of November 23rd, everybody in Erie County who goes to any type of public facility that is not essential, so like a restaurant, bar, any type of any type of store that is in any place in public, so essential, not essential, people have to wear a mask. And so we're hoping that that will have a change. So this is, if you want to look at this slide, again, at the end, looking at the yellow line, is if even just 10% of people are masking every time they go out in public, we will see a significant decrease in our hospital census from COVID-19, and that'll be due to a significant decrease in the number of new COVID-19 cases. So the bottom line is masking is powerful. Masking prevents COVID-19 transmissions, and masking will change around our hospital census and open up beds so that people with illnesses beyond COVID-19 can get a hospital bed and get a care that they need. We have the power to make a change. We have the power to change the dynamics of our hospital census and our COVID-19 numbers in our community by masking. Masking is a very powerful prevention tool, so we have control of where we're going to fall with COVID-19. So going through in terms of vaccination, because again, that is a tool that we have control over that can decrease our number of COVID-19 cases. This is looking at data provided by the New York State Health Department of Erie County residents' vaccination numbers of people having at least one COVID-19 vaccine by age group. And so you can see, in general, our seniors are very well covered. Most of our seniors have had at least one dose. And then if you go online yourself and look at the data, most of our seniors have had are fully up to date with their vaccines. They've completed their vaccine series. However, our younger people, people in their 30s, 40s, 50s, and even our adolescents and school-age children have much lower vaccination rates. The good news is that our 5 to 11-year-olds, our school-age children, we're making good progress with increasing the proportion of 5 to 11-year-olds in Erie County who've had at least one dose of COVID-19 vaccine. We've seen good progression since we started offering the vaccine. However, we've seen very little movement in any of the other age groups, and we really need to get those numbers up if we're going to have an effect of our COVID-19 cases and our hospitalizations. And then this next slide is looking at again, people who had at least one dose of COVID-19. Just gonna. Right, across all of Western New York, not just Erie County. So, again, we need to get those numbers up, because what we're seeing in our hospitals is not just what we're seeing in Erie County in terms of COVID-19. As the county executive mentioned, it's also what we're seeing throughout Western New York in COVID-19 cases and people becoming ill and getting admitted to the hospital. So let's talk about what we're doing in Erie County to respond. Well, first of all, the big buzz right now with COVID-19 is the Omicron variant that we're seeing globally right now. Fortunately, we haven't detected any cases right now in the United States, although it is breathing down our neck and it's probably here and we just haven't found it yet. There have been cases detected, of course, in South Africa was the ground zero where the original cases were found. It's also been detected in the Middle East, Australia, Europe, and again in Ontario, our neighbor. So we just imagine it's just a matter of time before we start to see it here in Western New York, including Erie County. So there's a lot we don't know about the Omicron variant. It's only been around for about a week. We don't really know much about it. So we don't know if it's more transmissible or less transmissible. We don't know about the severity of illness it causes, and we don't know about how protective the vaccines will be against preventing moderate to severe illness from the Omicron variant. So we're going to hopefully know that all in another couple weeks, but again, there is a lot we don't know right now, and we can't really make any assumptions. So the good news is that the labs that we run, the COVID-19 PCRs that we run in our public health lab is able to detect the Omicron variant. So if people are infected with that variant, they will have a positive PCR test if the test is done by our public health laboratory. Many of the PCRs available in our community will detect it. It's possible that not all may detect it because it's a new variant, and it depends on where the PCR is looking, what specific proteins it's looking for on the SARS-CoV-2 virus. However, with our public health lab, we will be able to detect it. And also, we know that UB's genetics sequencing group, Center of Excellence, is also looking at the Omicron variant, and they will be able to tell us when it appears in Western New York, and specifically Erie County. So right now, with all the recent data that they've compiled, we know that Delta is still the predominant strain in Western New York and Erie County. Almost all the strains of SARS-CoV-2 that have been identified even recently by the UB Center for Genomic Excellence has been Delta variant, maybe just one or two strains, but everything else is the Delta. So that's pretty much what we're dealing with right now. So another program that we're starting that is new, but we want to help children stay in school in Erie County. So we are piloting in Grand Island a Test to Stay program. So a Test to Stay program is where a student is identified as a close contact to COVID-19. If that student is vaccinated, they don't need to quarantine. However, if that student is not fully vaccinated, then they do need to quarantine. However, with this opportunity, this Test to Stay, if they remain asymptomatic and they're tested every single day during their quarantine period, so serial testing, before they walk into the classroom, we know what their status is, they will be able to remain in school in the classroom. This is only for the classroom activities. It does not permit them to go out into other extracurricular activities during their Test to Stay quarantine, but it will allow them to stay in the classroom, so they will be able to learn. So we're working with Grand Island to pilot this. We're hoping that the pilot will start in another week's time. And we're going to be looking at our process variables and outcome variables to see if this works, if the school can do it, if this is scalable to the rest of Erie County, to see if we will be able to expand this program to keep more students in the classroom. So remember, to the Test to Stay, if children are fully vaccinated, this is all irrelevant. They don't need to quarantine. So the best way to keep children in school is to make sure that they're vaccinated if they're old enough to get vaccinated, so anybody 5 and up. And I know that people are thinking about being able to prove their vaccination status. So we want to make sure that Erie County residents know that we can help them with that. If they can't seem to find their vaccine card, we can look that up and then mail them a replacement. And then also sometimes the data entered on people's vaccination records into the New York State immunization system, it may be a little bit off, it might be a little bit inaccurate, and then they won't be able to download the Excelsior Pass. So we can help them correct that information in the New York State NICES system, and so then they will be able to download their Excelsior Pass. So if you need help with any of that, getting a new card by mail, or getting your information corrected so in the NICES so you can get an Excelsior Pass, you can just give us a call at 716-858-2929, and we can make that happen for you. Also, we are still working very, very hard with contact tracing. As the county executives show you, our numbers of COVID-19 cases continue to be high. every single day. And so our COVID-19 contact tracers are working very, very high. And so what we're doing, we're focusing on right now, because the number of cases are so high, the number of contacts are high, we are focusing on the highest risk transmission. So those are people in the household, and those are people in the school settings. So we're doing complete case investigations on those individuals and those close contacts. However, if people have been diagnosed with COVID-19, we really strongly encourage you to let the people know who are your close contacts at work, in your social network, that they have been exposed to COVID-19, if they should quarantine if they're not fully vaccinated, and they should definitely get a test 5 to 7 days after the last exposure, especially if they have symptoms, they should get a test right away. So it's really important. And where we believe that we're seeing most of the transmission, what our cases report to us, is they believe that they've been infected in small gatherings, large gatherings, going out to restaurants or bars with friends, or going out to a party in somebody's house. Everybody feels fine. They get a phone call a few days later. They find out somebody in their group was positive. They get a test, and they find out that they're positive. So we're seeing a lot of transmission, what we believe, in all different types of gatherings, in all different types of social venues. Restaurants, bars, people's homes, you name it, people are reporting that to us. And since most of our seniors are fully vaccinated, including in the nursing homes, we're seeing very few cases in the nursing homes, despite the very high numbers of COVID-19 cases in the community. We've only had in the past couple weeks, 2 weeks ago, we only had 28 cases out of 4,500 nursing home residents. And this past week, we only had 55 cases out of about 4,500 nursing home residents. So it's a very, very small number, a very, very small percentage compared to what's going on in the rest of the community, where not everybody's vaccinated, not everybody's masking or social distancing. So we know that all these preventive behaviors can work in a controlled setting. So we know that the holidays are approaching. We just had Thanksgiving. People were getting together during the Thanksgiving holiday with friends and family from out of town that they don't usually socialize with. During the Christmas holidays, again, people are going to be getting together in small gatherings and large gatherings. So people should think twice about holding those gatherings. You might want to postpone them until our numbers go down. And then, especially if you're not fully vaccinated or if you're immunocompromised for any reason, you might want to think about skipping out on those gatherings just to protect yourself. So we have to do everything that we can to protect our community from COVID-19 and to protect our patients in the hospital, and being able to keep hospital beds open so that people are really sick are going to be able to get into the hospital and get a hospital bed. We don't want to see what happened here, that is what happened in the South, and people who were sick weren't able to who needed a hospital bed weren't able to get a hospital bed and who died. So we know that the hospitals, as the county executive presented, are full, they're at capacity. We know that the wait times in emergency departments and emergency rooms are super high for problems that are not completely emergent, life or death situation. So we have to think twice. We have to think about keeping our COVID numbers down, because we have to protect every single hospital bed. So I'm going to turn it over to our county executive to talk about our phased approach plan.
Thank you, Dr. B. As I think all know, we've implemented a 4-phase approach to reduce caseloads and control hospital admissions, as Dr. Burstein showed from the Western New York COVID-19 Analytic Group. The wearing of masks should, if it's followed, reduce the amount of hospitalizations in our region. We haven't seen it yet. They unfortunately continue to grow, but we do have a mask mandate for all indoor public locations in Erie County. If things continue to get bad, then we go to phase 2, which of course is a vaccine mandate for all bars, restaurants, and other types of places like theaters, movie, and otherwise. The 3rd phase would be capacity restrictions, limiting it for like 50% capacity. Nobody wants to do that. And the 4th is shutdowns. I think if we continue to do the right thing, wear the masks, we'll never even have to worry about number 2, nevertheless 3 or 4. Now, people are asking, well, how do you do this? And we talked about we're going to assess the need for additional measures using COVID-19 case data, the positivity rate, and especially hospitalizations on December 13th, 2021, unless the conditions require an earlier implementation. So between when we announced this last Monday to where we are today, the total hospital capacity has basically remained steady the past week, about 90%. Has not gone to the point where we're 100% full in all hospitals. Though, as I noted earlier, ECMC is at 100% capacity. Cases have increased and the positivity rate has increased. That is very concerning because as the cases go, usually goes the hospitalizations. And we've also seen a number of deaths. We didn't talk about it earlier, but there were a number of deaths last week, including those in a younger age category. We are very worried about the spike in new cases following the Thanksgiving holiday. Thereby, that would require new hospitalizations. The numbers last week were very bad with regards to new cases. We had a little lull with total cases in the last few days, but we expected that because there were less people being tested. The positivity rate was growing. The positivity rate was 12% yesterday and over 800 cases again. So we're very concerned. That's why if you wear a mask, when you're out in public locations and these gatherings, your odds of catching COVID are much, much, much lower. So that's why we implemented a mask mandate to control the hospital bed counts so that they do not get overrun. And then now we're not talking about an 8 or 12 hour sitting in the emergency room. Basically, they're telling you you have to go somewhere else. You have to leave that hospital because you're not going to get served. That's what we're worried about, and we're trying to avoid that. Erie County Public Health Lab diagnostic COVID-19 testing. If you're not feeling well, please get tested to know your status, even if you've been vaccinated. We know COVID can spread to people who are vaccinated. They usually have milder cases, but you can then spread it to other people. We do offer PCR, which is the molecular test. It's available, generally your results in 1 to 3 business days. We've been pretty busy lately, but we're still turning it over in 1 to 2 days. Point-of-care rapid tests are available for symptomatic K to 12 students and symptomatic school staff. The schools know about this. They should be talking to the Department of Health on that. Appointments are required. 716-858-2929. You call our Department of Health and they will schedule an appointment in that situation. Same number to schedule a vaccine. A lot of people are wondering, and I've heard in the last couple days, a lot of the booster shots that were available in other locations are running out. We have the ability to booster people. We have multiple locations that we're doing clinics, including working with Western New York Home Care in a location in Buffalo and at SUNY Erie South. You can call us at 858-2929 to get vaccinated, whether it's the first dose, second dose, a booster dose, or to schedule a test. And of course, go to erie.gov/vax to find out more about the locations. You can make an appointment online. We have the clinic that we're working with, Buffalo Home Care, all ages, all doses in downtown Buffalo at 490 Delaware. There's a Transit Road location that'll be opening very soon. As soon as that's open, we'll let you know. Of course, we have the SUNY Erie South location, and there's no cost. Call 858-2929. Boosters, I'm going to turn it over to the doctor to talk a little bit more about the boosters. She's the doctor. Get my mask. It's a $1 bill.
Thank you. So we know, especially with these new variants potentially entering our community, it is essential that everybody get every single vaccine dose that they can, that it's recommended. So booster doses for anybody 18 and up is very, very important, and to really help protect us against developing any type of moderate to severe disease, requiring hospitalization, and even it'll save our lives. So people ask, well, am I eligible for a booster? Should I get a booster? I get that question all the time. So if for people that had the mRNA vaccines, either Pfizer or Moderna, anybody who is 18 years and older can get a booster dose of either Pfizer or Moderna if it's been at least 6 months since their second dose, and also if they have if they want to get a different vaccine, if you got Pfizer and you want to get a Moderna booster, you got Moderna, or you want to get a Pfizer booster, that's fine. But we just want everybody to get that booster dose if they had their second dose, they were fully vaccinated 6 months ago or more. So all you need is that 6 months, and then you can get that booster dose that'll really boost your protection against COVID-19. And then for people that received the Johnson & Johnson vaccine, anybody who was 18 years and older and received their first dose 2 months or more, then they are able to get a COVID-19 booster. They can get a J&J, they can get a Moderna, they can get a Pfizer, whatever you feel comfortable with. We want to give people options. But the bottom line is it's so important to get this booster dose. If you've completed your vaccine series 6 months ago or more, please get a booster dose. As the county executive mentioned, we have sites to get free vaccination with a good supply throughout the county, and we're opening up more sites. So I'm going to turn it over to the county executive to answer questions.
Thank you, Dr. B. We will start off today with Fox News, Olivia Dance. Your line should be open.
County executive. So my question is, obviously the county and both the state is pushing for vaccinations, including vaccines for children. A parent in our own building here actually just got all that their child's vaccine appointment was canceled because the state didn't send them the vaccine supply. They said children and other pharmacies also put in their supply. So my question is just, this is a widespread issue. Are we missing vaccine supplies, and what kind of message does this send?
Well, I can talk only on behalf of Erie County, and we have sufficient doses. I know we do. I think if anything that has happened is there's been a tremendous ramp up lately with the higher cases, so more people are trying to get doses. But I do know we have sufficient doses available. If someone tried to schedule it elsewhere and it was canceled, they should call 716-858-2929. And I would just say that you have to probably talk to the state and figure out what may have happened at the state clinic. I can't answer that because all I know is we have sufficient doses in Erie County.
Do they have sufficient pediatric doses though in the county?
Yes, yes. Well, the county Department of Health does. I can't say what others have because I haven't seen that data. I don't know, but the county Department of Health does. Our appointments are filling up, but we have sufficient doses to meet those appointments. George Rickert, WIVB-TV.
Hi, Mark. I'm wondering if any businesses have been cited or fined yet for failing to enforce the mask mandate, and if not, how are you going about the 80 complaints or however many you've received?
I don't believe we actually have fined any party yet. We have gone out and talked to business owners if they were not following the rules. We do give a warning, as we said before. We give a warning. And then, of course, there would be a return. There's been no fines. No. And so at this point, no one's been fined, but there have been those that have been identified for failure to follow the rules, and they have been given a warning. And if we go back and we find them, I should say, in continued violation, then they're subject to fines. We would issue the fine. Information would be shared with our friends at the State Liquor Authority if they have a liquor license. So we're just hoping that the businesses understand that we have no interest in fining anybody, nor do we have any interest in shutting anyone down if it got so bad that they were a repeat offender. We just want people to wear masks. It's bad out there with COVID, and I hope people would understand it, including the business owners. And the last thing I think any of them want during this holiday season is to be fined or risk potential shutdown. Eileen Buckley, Channel 7. Are you there, Eileen?
Thank you, County Executive. Can you hear me okay?
Yes, go ahead.
Okay. Does the county know why Infinity stopped the COVID testing at the Buffalo Public School District, and how quickly will the county be able to find a new provider for them?
We had no warning. We did not know that. The school district learned it at the same time. Actually, they probably learned it before we did. We did not find out originally. They just walked away from it. The county has offered currently another one of our sources to the school district. It's in the school district's hands to determine if they will use that resource. But the county itself does not provide the testing for the city of Buffalo. we're doing the Test to Stay pilot program in Grand Island, but that's the only one that we're doing. We offer suggestions based on the parties that are out there, and an additional party has been recommended to the Buffalo School District. I'm disappointed in any critique of the county coming from the Buffalo School District because we, first off, didn't have any advance notice about it. And secondly, we're not the ones that are responsible for delivering this, it's the school district itself. So we advised the school district of another source. We recommended that other source. It's now in the school district's hands as to whether or not they take them up on it. But any accusation that the county is the one that should be doing it is completely without merit. We do not have the capability as a county to be doing these types of testings on the mass scale for the Buffalo Public School District. We are doing a small Test to Stay program with the Grand Island School District, but we do not have the capability to do testing for all school districts in Erie County. It just is not possible, and that's why we have to rely on these third-party sources. Steve Brown, Channel 2 News.
Thank you, County Executive. Do you think that some effort to greater restrict surgeries in hospitals, non-emergency surgeries in hospitals and other procedures would provide the bed cushion that would otherwise, keep hospitals from, if you will, overflowing?
Well, I do know that Erie County Medical Center Corporation for the last few weeks has basically stopped elective surgeries, except for outpatient ones where the surgery can occur and then the person can be out the door by the end of that afternoon. I know Catholic Health and Kaleida have been considering it. I don't know exactly where they stand. The governor has basically ordered that depending on the capacity of a hospital, they would have to do that. It would create some more beds. I'm not certain it would necessarily solve this issue. That's why the governor talked about yesterday impaneling or calling up the National Guard from around the rest of New York, but not Western New York, to help in the nursing homes so that we could free up some of those beds in the nursing homes. People are saying, why aren't we calling up the National Guard in Western New York? The problem is we would just be pulling individuals who work at one facility to move them to another. It's not like if you have an individual who's at ECMC, that if you pulled them for the National Guard and you sent them over to Kaleida or a nursing home, it would solve the problem, would create just as much chaos in the other facilities. So the governor's, based on my requests and others, is taking action. The biggest thing that'll affect it is basically mask wearing by keeping the transmission rate down so that we don't have as many people getting ill. And that's pretty standard. We know what's causing the big spike in cases, and we know what causes hospitalizations, and that's a spike in cases. So anything that can reduce the bed count in the hospitals would be very much appreciated from the hospital leaders themselves and myself, so that we can get out of the situation that we're in and go back to more of a normal period. Breanne Rozier from Spectrum.
Hi, thank you. We're seeing town supervisors and other local leaders discouraging mask mandate compliance and sort of denouncing it themselves. What is the county and/or health department doing about that?
We have a mask mandate in all of Erie County, including public locations, including these towns and other locations. I'm very pleased to see what was a response from some of the businesses, including in the town of Marilla. After the Marilla supervisor said they're not going to do a mask mandate, two of the biggest businesses that welcome the public into the town of Marilla said, oh no, we're going to require a mask mandate because we want to protect our staff, we want to protect our clients. I think the public gets it. I was out a number of places this weekend, grocery shopping and so forth, and including at one of the largest grocery stores in the area, and I saw one person who wasn't wearing a mask while hundreds and hundreds of people were wearing masks at this grocery store. I think people get it. They see the numbers. They know people who are getting sick. They may know somebody who died, because unfortunately we've had some deaths, including in under the age of 40 category recently. So I would just hope that people wouldn't politicize this. The masks is not a political statement. It is an issue associated with protecting the public's health and reducing further transmission. We can wish that the numbers would go down in hospitals, or we can act on it. And wishing does nothing. And saying, well, I wish the hospital numbers would go down, I hope the hospital number goes down. But if we don't take action, they're going to continue to rise. So we took action with regards to the mask mandate because it is the best way to protect and prevent the further transmission of COVID-19, which is the best way to protect and prevent hospitals from getting overrun. B News, Emily Stoll.
No questions at this time, thank you.
Okay. I know Chris Kelly, our ASL interpreter, has to leave in a few minutes, and we want to honor her time. So is anybody on from the Buffalo News? Is there anybody on from WBEN?
Tom Prohaska from the Buffalo News here, Mr. Poloncarz.
Sure, Tom, go ahead.
Sorry. In regard to what Dr. Burstein said about rescheduling holiday gatherings, does the county intend under its emergency powers to try to prevent holiday gatherings?
There's no thing, Dr. Burstein didn't say reschedule holiday gatherings.
You said people should think about rescheduling those gatherings.
Well, let's just say that we think that people should do things appropriately by wearing masks if necessary, or getting tested beforehand. I don't think she said reschedule holiday gatherings. But at this point, we want people to be safe and smart, and the best way to do that is wear a mask, as well as get tested before if you're going to go to a gathering like that. Know your status. I actually tested, and people in my family got tested for Thanksgiving by doing one of those take-home tests that you can order and buy online. And thankfully, everyone came back negative. Because if someone came back positive, of course, not going to that gathering. So wear a mask. Be careful out there. We know it is the holiday season. Hanukkah started 2 nights ago, and we certainly wish everyone a happy Hanukkah who celebrates. And if you are gathering with other people and you don't know your status, it's best that you know your status, and you may want to consider wearing a mask in these private locations, just like public locations, to protect yourself. WBEN.
Mark, there is a clarification we want to get from you and Dr. Burstein. In the emergency order, vaccinated people can spread COVID, but vaccinated venues are safe. Could I please get a clarification on that from either you or Dr. Burstein?
Well, we said this all along, that if you are 100% vaccine mandate, you do not have to wear a mask at this point. We do not want to punish people for being vaccinated, and we know that the rate of transmission among vaccinated people is much less than is for those that are unvaccinated. So since we instituted the order, it was if it's a vaccine mandated facility, which is right now privately done except for the county facilities, you do not have to wear a mask. And what I've heard is that those locations that did that, they have to have a plan. They have to be subject to plan to looked at by the Department of Health. You do not have to send it to us, but if we stop by, we want to see you have a plan in place, how it's being enforced. And if it's being enforced, you do not have to wear a mask. If we hear places are saying they have a vaccine mandate, but they're not checking vaccine status at the door, well, then they got to go back to 100% masking. Final question to WBFO. Okay, we thank everyone for being here today for our update. I want to thank Chris Kelly from Deaf Access Services for providing the American Sign Language. Our numbers are not great. They haven't been great for a couple weeks now. We seem to have stabilized a little bit on the hospitalizations with at least being at 90% capacity, but there are some hospitals in Western New York that are full. And the best way to prevent the rest of the hospitals from being overrun is to wear a mask when you're out in public. And if you are doing small gatherings and you don't know whether individuals are positive or negative, you should probably wear a mask as well. Be safe and well to all. Take care.